Hi, I'm Dan Porterfield, the CEO of the Aspen Institute, and thank you for joining our new feature, Aspen Ideas Now. We're very proud today to be able to host Ron Klain, who is one of the great leaders in the country on making government work, having served twice as Chief of Staff to Vice Presidents of the United States, and having been the czar for the Obama administration's extraordinary efforts to deal with the Ebola crisis a few years back. Ron, thank you for joining us today on Aspen Ideas Now.
Thanks for having me, Dan.
Would you say a little bit of set the context of what it was that President Obama asked you to do when he named you as the Ebola czar? And looking back, what are some of the lessons learned from that experience relevant to today's crisis?
Yeah, so in the fall of 2014, America was launching a major effort to try to fight Ebola in West Africa. It was the worst Ebola outbreak in history by a factor of many. There had never been an outbreak of more than 500 cases. Now there were thousands and thousands of cases. People were worried that it was going to spread throughout Africa and ultimately to Europe and to the United States. So President Obama mustered what he called the whole of government response, said we were going to do whatever it took to fight Ebola there and to protect the American people from the risk of transmission here. And he asked me to come in and take over and coordinate that effort, to coordinate the scientific advice he was getting from the scientific advisors and the big execution problems of having 10,000 people on the ground in West Africa, having the first ever deployment of U.S. troops in our history to fight an epidemic, Operation United Assistance in West Africa. So that's what we were doing then. I think there are three lessons from that that really come through today to fighting COVID. COVID's a very different challenge. I mean, on the one hand, Ebola is much more lethal. We had about a 70% fatality rate from Ebola when we started. But COVID spreads much more easily. And so it's spreading much more wildly around the world than in our own country. So different challenges, but some things that translate. The first thing that translates is, in something like this, you have to put one person in charge. And I think one challenge we've had so far with our response is kind of a bit of a rotating sequence of leaders over the thing. And I think, again, kind of some kind of clear leadership structure is really important. It's complicated. There has to be accountability, responsibility. I think the second thing you have to do is you really have to put science at the forefront. I'm not a scientist. I'm not a doctor. That's not what we needed. The president had the best scientific and medical advisors in the world. People like Tony Fauci, who's, again, prevalently involved this time, but was the president's chief medical advisor, along with Dr. Tom Frieden, who was head of the CDC, and Dr. Nikki Lurie, who ran a key part as at HHS. And the direction the president gave us was, hey, let the scientists make the strategic decisions, but then you go get the government to implement those decisions and to really try to make those decisions effective. The last thing you have to do is you have to put politics aside. I mean, these viruses, they don't really respect partisan lines. The virus doesn't know if it's infecting a Republican or a Democrat, red state, blue state. And to the extent we can, we need to take politics out of it and try to have an expert-based, comprehensive, robust, all the tools of government at work on fighting something like this challenge.
Yeah, I want to come back to the tools of government in a second, but I want to bring in a second theme from your career. You've also been in senior roles in government when we were dealing with major economic crises in the past, and particularly the recession of 2008-9. But are there any lessons learned from those experiences, independent of the health questions now, about the American economy?
Yeah, I mean, as you alluded to, I was Vice President Biden's chief of staff when he was put in charge of implementing the Recovery Act in 2009. And so I kind of oversaw the team on a day-to-day basis that did that work, that reported up to the vice president. At the time, it was the largest recovery effort in American history, $900 billion. What we're doing right now, $2.2 trillion, is significantly larger. And I think some of the same principles apply. I mean, I think one, you have to move quickly and comprehensively. And I think that's a really important thing. The economy is a big problem right now, like it was back in 2009. You need bold, decisive action. Secondly, you need to really focus on the people who are hurting. Those are the people who are the most hard pinched. They may be people who lost their jobs, or people who are struggling to hang on to a job, people who don't have the kind of robust savings or safety net. That's really the starting point, both from doing kind of the humanitarian thing, but also getting the economy going. Those are the people who, if you get the money, can spend the money, can really get things going. And then again, there should be a sense of bipartisanship about some of these things too. There are going to be differences, of course, but I think it's important to try to work with people, all leaders. So Vice President Biden, for example, when he ran this effort, had calls every week with governors and mayors without regard to what party they were in, both Democrats and Republicans, tried to solve their problems in implementing these big recovery programs. And I think that's an important aspect of it too.
Yeah. So now we put these two things together. We have a pandemic. It's a global health crisis with tremendous negative impacts in our country. And we have a global economic crisis, again, with tremendous negative impacts for America. How do we think about the balancing of both needs and move forward?
Well, Dan, I think that the healthcare situation comes first. And let me explain why. I mean, first of all, at one level, it seems obvious that's right because it's a question of life and death and so on and so forth. But secondly, our economy works on confidence. It's one thing for political leaders to stand up and say, hey, let's open up the stores, let's open up the restaurants. If people don't think they're safe, they're not going to go. You know, we have a consumer-driven economy in the United States and throughout most of Western democracies, and people aren't going to go shop. They aren't going to go to stores, not going to go to theaters, whatever. Even if you put the open sign in front of them, if they feel like I'm going to go there and I'm going to get sick. And so, and also we have to look out for the workforce. I mean, even during this period of economic shutdown, there are a lot of people at work delivering groceries, delivering packages, creating electricity, making the internet that lets you and I have this conversation. And so those people, we need to protect them. And as we dial back up the economy, we need to protect the workers who are putting back to work. This isn't an on-off switch. I think that's the biggest misconception about this, Dan. We talk about the economy is off now. It's not off. There are a lot of people working, but as we increase that, it's like a dimmer switch. We're going to slowly dial that back up. We have to do that in a way that wins the confidence of consumers that it is safe, because it is safe, and we have to do that in a way that protects the workers. And that means we have to be able to test people on a widespread basis so we know who has the disease, who doesn't. We have to contact trace those people, that is, figure out who those people who have the disease have been in touch with. And we need to make sure our healthcare system is strong in areas where people are going back to work so that we can make sure that when people get sick, they can be taken care of without kind of blowing up the healthcare system.
Thank you for that answer. And let's dig into each of those elements. There's a bit of blocking and tackling involved here in this. Start with testing. Where are we today, and where would you like to see us get?
So testing has been one of the most frustrating and disappointing aspects of the response here in the US so far. And you see a big difference in this around the world. Germany, for example, is testing right now at 3 times the per capita rate that we are. South Korea, certainly at the key phases of this, they've really gotten this under control for now, at least, tested at almost 10 times the rate we were testing. So we've been behind other developed countries on this. And without getting into the political fight that's going on about this, there is a real debate between the governors and the White House about who should be responsible. And I think what the argument for why the White House needs to take more responsibility here is that the testing system is really a global system. The products that are involved in testing, the chemicals, all the elements of it, the parts of the machines that process the tests, they come from overseas in large part. And so we need one national effort led by the White House to get those test products here to the country, distribute them where they're needed, and really ramp it up. We're probably right now, Dan, at about 150 to 170,000 tests a day. I think most experts believe we need to be at least at 500,000, 750,000 tests a day. That's obviously a big, big scale up. Now, technology is improving. I imagine sooner or later we'll get there. But this connection between the conversation we're having here, between getting the economy open and doing this testing project, are really connected, because if we reopen parts of the economy without widespread testing, we're going to all be out there interacting with people who are sick, who are spreading the virus. We're not going to know. And that's just going to make this situation pop back up. Last thing on this, people need to understand, I think one thing that's been both useful and unuseful in the public dialogue is we've seen these beautiful parabolas drawn on our TV sets and our computer screens. This is what the disease looks like. It comes up and it comes down. It looks like a high school geometry project when you see it. In real life, that's not how this works. So in real life, if you look at prior epidemics, 2 things are true that defy the parabola. The first is up goes faster than down. These diseases ramp up very quickly, but it takes a long time to get them down. It's not symmetrical that way. And the second thing is there's almost always a second, a third curve. The most famous pandemic in American history, the Spanish flu epidemic of 1918, 1919. In fact, the second time around was more deadly than the first time around.
Yeah.
So hopefully that won't be the case here. I think we're all hoping that this will be the worst we see of it. But we have to act and make decisions with the knowledge that it's harder to get it down than it was for it to go up. And that the risk, if we don't do it right,
Yeah.
is that we'll see a second or a third wave that could be just as devastating.
Yeah, so testing is a key part of being able to, as you say, use the dimmer to get people locality by locality back to work and to evaluate what's happening, to listen to the impacts, read them as they unfold. Now, the second part you mentioned was contact tracing. That may not be well understood by all listeners. What is that?
Yes, so contact tracing is a very old, 100-year-old public health technique where we figure out who has a disease, and then we ask that person who they've been in touch with. And then we go see if those people are sick or not. And what we find is that in all these epidemics, you can trace back where it started, who gave it to who gave it to who, so on and so forth. And by doing that, you can start to isolate those people who have it and are transmitting it and slow the transmission. You have to identify how the disease is being spread. Now, contact tracing is really, really labor intensive, just as the description, I hope, reveals. If you, Dan, tested positive, we'd go see you. We'd say, hey, who have you seen in the past 14 days? You'd give us a long list of people. So we wouldn't have to go knock on all those doors or call all those people. This was a big part of the Ebola response in West Africa under tough circumstances there, because we had some countries, Guinea, for example, 60% of the country had no cell phone coverage. So you couldn't call people up. You really had to go door to door. Here in the United States, of course, it's going to be a little bit easier to do that. But we also have a lot more contacts in the United States. We're all, except when we're in this social distancing mode, we all contact a lot of people. So if we're going to reopen parts of the economy, we're going to turn that dimmer switch back up, people are going to have more contacts. That's why contact tracing gets more complicated. Now, people are talking about using some technological solutions to that, Dan. Say maybe check who your cell phones was near and use the power of technology to make that a bit easier. There are obviously privacy issues raised by that. And also technology doesn't solve the whole problem. Just to know that your cell phone was in the same area that my cell phone was in, that doesn't mean we shook hands or we got close to one another. And so there's going to have to be a human element in addition to the technology. That's a lot of work. It's also a bit of an opportunity. We have a big unemployment problem in America right now. We could hire a bunch of people and put them to work on this contact tracing project.
Mm-hmm. So then that's the second piece you mentioned. The third piece was about, I think, making sure that our healthcare workers have the proper supplies. And say a bit about that.
Yeah, so what we've seen in cities that have been hard hit, places like New York and Boston and other parts of the country, it really devastates the healthcare system. It devastates the healthcare system in terms of using up supplies of masks and protective gear, the protective face shields, the protective gowns and gloves people need. And they're burning through them very quickly. And so you want to make sure that, first of all, you get the healthcare workers a bit of a respite. You get the ones that are sick recovered. That's always happens in epidemics. Healthcare workers really pay the price. They have nonstop contact with sick people. A lot of them get sick. We need to get those people healthy and back on the job. And we also need to make sure that they have the protective gear they need to lower their risk. That's, of course, the humanitarian, the right thing to do. Healthcare workers are our heroes. We don't want to send them into danger, but it's important for the capacity of the healthcare system. We often find in epidemics that not only do the people who have the disease suffer bad health consequences, but other people do because they can't get access to the healthcare system. Cancer patients maybe can't get their treatments. They don't want to go to the hospital. They're nervous about going to the hospital because the disease is there. Heart attack patients don't get brought into the hospital. And so you've got to really, in these places that have been hard hit, get the healthcare system in a place where it's functioning well equipped, well stocked, so that we can provide both care to people if the disease reemerges in places, but also care to everybody else who right now aren't really getting the kind of healthcare they need.
So those are three prongs of a strategy that we need to be able to implement. It's not just a matter of having a theory. We got to be able to carry it out. Yeah. And there, of course, you need executives at state and local and federal government all doing their part. They've got to work together, not at cross purposes. Something I read today that really fascinated me in the New York Times was a piece by the science reporter, Don McNeil, about some of the things we don't know yet about the virus. We're still early in this.
Yeah.
Is there anything that you sort of have been thinking about is like you wish we knew the answer to now?
Yeah, the most important question we don't know the answer to is if someone gets this disease and recovers, are they immune? So much of our strategy in dealing with epidemics assumes that once people have it and they recover, they're immune. And so that means that they're not victims at risk of becoming victims of the disease again. So they can go back out and do things and not be at risk. With this virus, we just don't know what's going to happen. We don't know how strong people's immunity is going to be, and we don't know how long that will last. If you get small chicken pox as a kid, you get it once, you can't get it again. You're immune for life. But a lot of other things we get, like colds, you get them once, you get over it, you can get another cold later on, right? And how the coronavirus will behave on that spectrum is just a big unknown. It really has a huge impact on our strategy for dealing with it. Now, we're seeing some early data that maybe people in Korea and other countries who've had it before can get it again. But again, it's just really early days. I caution people from forming firm conclusions one way or the other till we really know. I mean, this is a disease that didn't really exist as far as we know just 4 months ago. I mean, let's give credit to the scientific community for learning a lot very quickly. But on the other hand, as frustrating as it is, science takes time.
Yeah.
And these questions that we desperately want the answer to, it's going to take some study and some research to get those answers.
So in addition to the testing, the protection of healthcare, the developing contact tracing, you're leading right into a key thing, which is that we've got scientists around the world working on both therapies and a potential immunization. This will take time and require scientific expertise. Do you have any thoughts about either the race for effective therapies or for an effective vaccine?
Well, I think both of them, again, amazing work is being done on both fronts. History teaches us that almost always these therapeutics come first, because what we're doing is we're taking drugs that exist, antiviral medicines, and giving them to patients. And because they already exist, we'll find out which of those work faster than having to build a vaccine from scratch. So, there's promising results about certain antiviral medicines that may well work here. And I think we will have medications that help hopefully soon. Now, look, that's partially helpful. I mean, obviously, if a pill can keep someone getting seriously ill or someone who's seriously ill, help them get better, that's a great thing. It's not keeping people out of going to the hospital in the first place. It's not really preventing people from contracting the virus. That's what a vaccine would do. A vaccine takes longer. We're kind of starting from scratch. And more importantly, I think with a vaccine, making a vaccine, it depends on which of these potential vaccines work, but often they are difficult to make. Some are harder, some are easier. What you're talking about is making hundreds of millions of doses to cover just the United States, billions around the world. That's a giant project. And then you have to get people immunized. And unfortunately, Dan, one thing we've seen in our country recently and in other Western democracies is a rise of anti-vaccine sentiment, vaccine reluctance, vaccine hesitancy, and everything that drives that. Social media, the internet, all these things, they're going to be really working overtime, unfortunately, when a new vaccine for this COVID emerges. And we'll have to persuade people to be willing to take the vaccine and to agree to the vaccine. And that is not going to be a small challenge in our system, in our country.
Let me pick up and ask you two questions about a similar kind of challenge in our country. And one is that there's probably some parts of the country, well, we know there are, where people are saying, hey, this virus hasn't affected our quality of life. We don't see that much sickness around us. Why should we shut down when the problem is elsewhere? And then that same question could be asked about the world at large, that the U.S. needs to take care of itself, and what happens in lots of other places, developing world, may be very sad, but that's not related to what we have to do. And how do you answer those two questions?
Well, they're slightly different, but they involve some similarities. And the core similarity is connectedness. So if you live in a part of the country that hasn't seen a lot of cases now, you're probably going to see them because Americans travel. We get on the interstate highway, we drive around, we go places. And so this virus is going to spread. Now, one challenge with the virus that's obvious is it's invisible. You can't really see that it's spreading in your community, but man, the hospitals, the healthcare systems do. And I think the people who are being kind of glib about it or saying, I don't see it, not going to affect me, I think they are sadly bargaining for trouble here because it is going to spread in their communities. A lot of people are going to get sick. And look, yes, it is true that this virus tends to have its worst impacts on older people. But there are younger people also with pre-existing conditions who've been hit hard by the virus. Obviously we owe a debt of gratitude and respect for our senior citizens and not to put them at risk needlessly. And it's just so easy for these things to spread. On the global front, I think the case for global health security should be pretty straightforward. We're only safe in this country if other countries are safe too. We live in an interconnected world. We can like that or not like that. We can wish that it wasn't the case. But the fact of the matter is there's no wall you can build that keeps disease out of this country. People travel, goods travel, people travel with the goods as they travel. Crews bring ships of goods over, planes of goods over. So, and we're in a world where we can't run the US economy without imports from other economies. I mean, that's just the way our system works. So if this disease starts to spread wildly in Africa, that's not just a humanitarian crisis, though it would be certainly, but it's ultimately going to come back to the US too. I mean, that's what we saw with Ebola. If we didn't fight the thing in Africa and beat it there, we'd have had more and more cases here. And so we are connected as a planet. I know that drives some people crazy. I know that some people hate that, but that is the reality of the modern world. And to ignore that is not just to be anti-humanitarian, it's to put our own selves at risk. It really puts the American people at risk if we don't help improve global health security around the world.
Let me close with a question then. And you're such a can-do, pragmatic optimist, but a realist about, how to solve problems. And what do you think success looks like on this one? If everybody does their part, federal government, state government, local people, citizens ourselves, the world, we all do our part. What would be a vision of where this ends up?
Well, first of all, Dan, I have to say, I'm sad to say, I think that we're already at failure. I mean, as you and I are having this conversation, America is about to see its 40,000th death from COVID. It will probably be over 50,000 by the end of April. And that didn't have to be. There were a few hundred deaths in Korea, which got its first case on the same day. They're a smaller country, but not that much smaller than us. And we right now are looking at the highest number of cases in the world and probably most deaths in the world. And so there's no way to look at that and not say that was a failure. I think the question is, what can we do from here? I think what we can do from here is try to maintain these social distancing measures as much as possible. That's something all of us can do, whether we're in a red state or a blue state. We ourselves can take responsibility and practice these social distancing measures. We need to also really push the federal government hard to fix this testing mess, to take responsibility and get the test kits out there, to improve the technology and the speed on the testing, and to make sure our healthcare workers and our healthcare system have the equipment and the protections that they need for all of us. This is a global problem. It is a national problem. Governors are showing great leadership, but they can't do it alone. They deserve the kind of help they can get from Washington. And I think finally, those of us who are in a position to be generous and philanthropic at this moment should be generous and philanthropic. We are seeing, because of the virus, huge economic problems. And a lot of people showing up at soup kitchens, feeding supplies, community kitchens. They need donations. They need support. Our healthcare workers, I think in many communities, there's a way to donate food, hot meals to people working double, triple shifts at hospitals. I just think there are a lot of ways we all can help and support. And if we're in a position to do that, that's an important thing. This is a huge crisis for our country, and so many people are being impacted. Whatever you can do to help, people should do to help.
That's Ebola czar Ron Klain with a tremendous commitment to serving the public good and to helping all of us move forward together. We thank you for joining Aspen Ideas Now. Wish you and your family the very best in the days and weeks to come.
Thanks, Dan. I appreciate it.